So the Harmony trial was a cardiovascular outcome trial with the GLP-1 receptor agonist Albiglutide, which is in fact now the fifth cardiovascular outcome trial that we've seen with a GLP-1 receptor like drug. And I think everybody was very pleased and surprised to see the very positive outcomes from this trial, as it significantly reduced the numbers of major cardiovascular events with all components of the primary endpoint, i.e. myocardial infarction, stroke and cardiovascular death, contributing to the reduction in endpoints. We've seen some heterogeneity, I think, in the trials with GLP-1 receptor agonists, so it's now very reassuring to see a third drug on top of liraglutide and semaglutide showing a very clear positive cardiovascular outcome. One of the very interesting things about albiglutide is that it is probably a little bit less effective than some of the other GLP-1 receptor agonists in terms of glucose lowering. The glucose lowering was clear with this trial, but it wasn't as great as we see with some other GLP-1 receptor agonists such as semaglutide. And also, although it caused a statistically significant reduction in body weight, the absolute reduction in body weight was less than a kilogram. And I think this starts to raise some very interesting questions about what the mechanism is for this effect of GLP-1 receptor agonists to reduce cardiovascular events in people with diabetes. It certainly doesn't seem to be glucose lowering, because we get similar glucose lowering with many other agents that don't reduce cardiovascular events, such as DPP-4 inhibitors, and it certainly isn't body weight, because I don't believe that a less than 1 kilogram difference in body weight could account for such a significant reduction in events. So this raises a very interesting question as to what is the independent mechanism by which GLP-1 receptor agonists reduce cardiovascular events. One of the issues with albiglutide is that for commercial reasons, the company that produces it has withdrawn it from the market, and they're currently seeking a partner. Now the question will then be whether this will be competitive against other agents that are more effective in terms of glucose lowering and also have greater effects on body weight, which is actually quite important to physicians and patients when they're treating people with type 2 diabetes.